Let me ask you something honest. If someone asked you right now whether you get enough exercise, what would you say? Most people over 50 who are health conscious would say something like, I try to walk regularly, or I stay pretty active, or I do more than most people my age. And those things might all be true. But here's what I want you to sit with for just a moment. What if being a regular walker, or being generally active, is actually only covering 1/3 of what your body needs to stay strong, independent, and resilient as you age? What if the 2/3 you're missing are the exact parts responsible for keeping you on your feet, keeping you out of a wheelchair, and keeping your muscles capable of doing the things that matter most to you day to day? Stay with me, because what we're covering today comes directly from the National Institute on Aging, and it addresses something that most exercise content for older adults glosses over completely. Most people focus on one type of exercise. Research shows you need 3. And the difference between doing one and doing all 3 is not a minor upgrade. It is, according to the research, the difference between an active lifestyle that genuinely protects your long-term capability and one that leaves significant gaps that quietly accumulate over time. We're going to walk through all 3 today, but there's one specific detail I want to build toward. Something about the third type of exercise that most people either skip entirely or don't take seriously. And it turns out to be the one most directly connected to the thing older adults fear most. We'll get there. First, let's build the foundation. Let's start with the exercise most people are already doing in some form. Aerobic activity, cardio, endurance training. Whatever you call it, it's movement that gets your heart rate up and you're breathing deeper for an extended period. Walking, swimming, cycling, dancing, climbing stairs, raking leaves, vacuuming, playing pickleball, all of these count. The National Institute on Aging is deliberate about including everyday activities in this category because one of the biggest barriers to aerobic activity is the belief that it has to look like a workout. It doesn't. What aerobic activity does in the body is specific and worth understanding. When your large muscles, your legs, your core, your arms, are working steadily, your lungs have to move more air, and your heart has to pump more blood to deliver oxygen to those working muscles. Over time, with consistency, your heart and lungs become more efficient at this process. Your cardiovascular system gets stronger, and a stronger cardiovascular system means lower risk of heart disease, stroke, high blood pressure, diabetes, and several forms of cancer. That's the long-game benefit. But there's also a same-day benefit that's worth naming. Even a single session of moderate aerobic activity can lower your blood pressure for several hours afterward, reduce feelings of anxiety, and improve your sleep that night. Those are not waiting for results benefits. Those are today benefits. Now here's a practical detail that changes how most people approach this. The research-backed target is 150 minutes of moderate-intensity aerobic activity per week. That sounds significant, but it's 30 minutes, 5 days a week. Or even shorter bursts more frequently throughout the day, because accumulating movement across the day counts toward that total. Here's a simple tool the National Institute on Aging offers for checking your intensity level. While you're moving, try to have a conversation. If you can talk fairly comfortably but you're breathing harder than usual, that's moderate intensity. If you can only get a few words out before needing another breath, that's vigorous. Both count. Vigorous activity counts at a higher rate, so 75 minutes of vigorous activity is equivalent to 150 minutes of moderate. The key safety principle for aerobic activity is simple but important. Aerobic exercise should not cause dizziness, chest pain, chest pressure, or nausea. If any of those things occur, stop and talk to your doctor. And always do a few minutes of lighter movement before and after more intense activity. A brief warm-up and cool-down prepares your cardiovascular system for the work and helps it settle afterward. Aerobic activity is the type most people do, but here's where most people get it wrong. They do only this, and it leaves 2 critical gaps. Let's talk about the second type of exercise, and I want to spend meaningful time here because this is the one that most directly protects your functional independence. Muscle strengthening exercise, resistance training, strength work. I know that phrase can conjure images that feel irrelevant or intimidating. Heavy barbells, gym machines, young athletes, and I want to set all of that aside entirely because the version of muscle strengthening that matters for older adults looks nothing like that. Here's what muscle strengthening activity actually means in practice. Any movement that asks your muscles to work against resistance, against weight, against gravity, against an elastic band, counts. Carrying groceries, digging in the garden, doing squats while holding the back of a chair, using light hand weights, resistance bands, push-ups against a wall. These are all muscle strengthening activities. And here's why this matters so profoundly for the life you actually want to live. Muscle strengthening exercise improves your ability to do the specific physical tasks of daily life. Getting up from a chair, climbing stairs, carrying bags, opening heavy doors, lifting things off the floor. These are not athletic achievements. They are the basic mechanics of independent daily life, and they are directly dependent on muscular strength. The research is specific. Muscle strengthening activities help you stay independent and make everyday tasks easier. They are key to maintaining existing strength, slowing the loss of muscle mass, which begins accelerating after 50, and helping to prevent falls and fall-related injuries. Think about what it would mean to you, concretely, to lose the ability to get out of a chair without help, to need someone else to carry your groceries, to be unable to climb a flight of stairs in your own home. These are not distant hypotheticals. They are outcomes that happen to people who lose enough muscle mass over enough years. And they are, in significant part, preventable. The National Institute on Aging recommends muscle strengthening activity at least 2 days per week, targeting the major muscle groups: legs, hips, chest, back, abdomen, shoulders, and arms. With one important note: don't work the same muscle groups on consecutive days. Muscles need a recovery day between sessions. That recovery is when the actual strengthening happens. You don't need to start with weights. In fact, if you're a beginner, starting with bodyweight movements, leg raises, wall push-ups, seated arm circles, chair squats, is the right approach. Learn the movements first, build the habit, and add resistance gradually as your body adapts. There's a breathing detail that the research specifically flags, and it's one most people don't know. During strength exercises, don't hold your breath. Breathe out during the effort, the hard part, and breathe in as you relax. Holding your breath during exertion can cause an unwanted spike in blood pressure. Breathe through the movement. It matters more than it might seem. This next detail changes everything about how beginners should approach strength training. One set of 8 to 12 repetitions of each exercise is effective, according to the research. You don't need to do 3 sets of everything. You don't need to exhaust yourself. One well-executed set, taken to the point where doing another repetition would be genuinely difficult. That is an effective, research-supported starting point. And from there, you can gradually increase sets, repetitions, or resistance over weeks and months as your strength builds. Now, we're about 65% of the way through today's video, and I need you to stay with me for this next section, because this is the part I believe matters most, and it's the part most people skip. This is why finishing today's video is worth your time. The third type of exercise: balance training. I want to address something directly. When most people hear balance exercises, they think of something gentle and supplementary, something you do if you feel wobbly, something for people who are already having problems. That framing is exactly wrong, and it's costing people enormously. Balance is not just a fall prevention strategy for people who are already at high risk. It is a physical capability that actively declines with age in everyone, and that can be trained, improved, and maintained at any age with regular, specific practice. Here's why this matters so much. Falls are one of the leading causes of injury, hospitalization, and loss of independence in older adults. And the research is consistent. Improved balance directly reduces fall risk. Not slightly, meaningfully. But here's the part that most people, and frankly many healthcare providers, don't communicate clearly enough. Balance is a skill. It is trainable. And the earlier you invest in training it, before you feel like you need to, the more resilient your balance system becomes, and the more fall-resistant your body remains over the coming years. Waiting until you've already had a fall, or until you feel genuinely unsteady. To start working on balance is like waiting until you've had a heart attack to start caring about your cardiovascular health. The time to work on it is before the crisis. So what does balance training actually look like? It's far more accessible than most people expect. Tai Chi is perhaps the most well-researched and consistently recommended balance activity for older adults. The National Institute on Aging describes it as a moving meditation, slow, deliberate, precise shifts of the body while breathing deeply. Tai Chi doesn't just train balance in the static sense. It trains your body's ability to maintain stability while in motion, which is exactly what you need in the real world, where falls happen while you're moving, not while you're standing still. Research on Tai Chi and fall prevention in older adults is genuinely impressive. Regular Tai Chi practice has been associated with meaningful reductions in fall frequency. It also improves flexibility, reduces stress, and can be done in a group setting, which adds social connection to all the physical benefits. Yoga is another option that combines balance, flexibility, and a degree of muscle strengthening in a single practice. Standing on one foot while holding a chair for support, walking heel to toe in a straight line, practicing sitting down and standing up slowly and with control. These are all legitimate, effective balance exercises. The safety principles for balance training are worth noting. Go slowly and mindfully. Have something sturdy nearby, a chair, a wall, a counter, that you can hold on to if needed. Wear stable footwear or go barefoot on a non-slip surface for better sensory feedback. And if you feel unsteady at any point, take action immediately to stabilize yourself rather than pushing through. The research recommends about 3 sessions of balance exercises per week. They don't need to be long. Even 10 or 15 minutes of dedicated balance work, done consistently 3 times a week, creates cumulative improvement in the neurological and muscular systems that keep you upright. Now I want to address something that ties all 3 of these together, and it's one of the most practically useful insights in the research. You don't always have to do these 3 types of exercise separately. There are activities that naturally combine multiple types. Dancing involves aerobic exertion, balance, and coordination simultaneously. Yoga combines balance, flexibility, and muscle strengthening. Tai Chi combines balance and flexibility with elements of gentle muscular engagement. Water aerobics combines cardiovascular work with resistance from the water and often incorporates balance challenges. Gardening, which many people already do and enjoy, involves aerobic exertion from sustained movement, muscle strengthening from digging, lifting, and carrying, and balance challenges from working on uneven ground and in varied positions. The research explicitly points this out. Activities like dancing, yoga, tai chi, gardening, and sports can be considered combination activities because they naturally incorporate multiple types of physical activity. This matters for 2 reasons. First, it means the 150-minute weekly target and the 2 days of strength training aren't necessarily separate time commitments that add up to a large total. A twice-weekly dance class might be covering aerobic, balance, and some flexibility work simultaneously. A regular yoga practice might be handling balance, flexibility, and muscle strengthening in a single session. Second, it means that the activity you enjoy, the one that doesn't feel like a chore, might already be doing more for you than you've been giving it credit for. And this is why doctors rarely explain this clearly. The exercise conversation tends to get siloed into categories: cardio, strength, balance, each one presented as a separate prescription. But real human movement doesn't work in silos. And the most sustainable exercise is the kind that feels like living, not like medicine. Let's pull this all together with practical actions. The first is to audit what you're currently doing. Take a realistic look at your weekly movement. Are you getting regular aerobic activity, even roughly 150 minutes across the week? Are you doing any muscle strengthening work, not necessarily formal lifting, but anything that challenges your muscles with resistance? And are you doing anything specific for balance at least a few times a week? Knowing where your gaps are is the starting point for filling them. The second is to add 1 thing, not 3. If you identify gaps in all 3 areas, resist the temptation to overhaul everything at once. Pick the most significant gap, likely muscle strengthening or balance for most people who are already walking, and add 1 practice that addresses it. 2 days a week of simple bodyweight exercises, 1 Tai Chi class, 1 yoga session, one thing done consistently for 4 weeks. Then reassess. The third is to look for combination activities that serve multiple purposes. If you're going to invest your time and energy in movement, activities that deliver aerobic, balance, and strength benefits simultaneously are highly efficient. Dancing, Tai Chi, yoga, water aerobics, gardening, these aren't lesser alternatives to real exercise. They're smart choices that address multiple needs at once, in a format that many people find genuinely enjoyable. The fourth is to take balance seriously before you feel like you need to. If you haven't done any specific balance work before, start now. Not because you're at high risk today, but because building a strong balance system takes time, and the best time to build it is before it becomes urgent. Standing on one foot while holding the counter. Heel-to-toe walking in your hallway. A regular Tai Chi or yoga practice. These are investments with long-term returns. And the fifth, as always, is to involve your healthcare provider in the plan, especially if you have chronic conditions, recent injuries, or significant concerns about any of the 3 types of activity. A physical therapist in particular can be an extraordinary resource for developing a personalized movement plan that addresses your specific limitations and goals. Many older adults have never worked with a physical therapist outside of injury recovery, but they are trained precisely for this, building functional physical capability in real people with real bodies. Here's what I want you to carry with you. Your body has 3 distinct systems that benefit from 3 distinct types of exercise. Your cardiovascular system needs aerobic work. Your muscles need resistance work. Your balance and stability systems need specific, regular challenge. Most people are only serving one of those 3, sometimes 2. And the gaps, the muscle mass that quietly erodes, the balance system that slowly becomes less reliable, the functional strength that gradually makes daily tasks harder. Those gaps show up eventually, not as a sudden event, as a slow narrowing of what's possible, a gradual retreat from the life you want to live. You don't have to let that happen quietly. The research is clear, and it is genuinely encouraging. All 3 types of exercise are accessible at any fitness level, at any age, with little to no equipment, and without a gym membership. The barrier is not resources or ability. It's awareness, knowing what the body needs and why. Now you have that awareness, and what you do with it is entirely in your hands. Before you go, here's something I want to leave you thinking about. We talked today about the 3 types of exercise and what each one does for your body. But there's a 4th dimension to physical activity that the research is increasingly paying attention to. And it has nothing to do with the type of exercise you do. It's about what happens in the hours between exercise. Specifically, what sitting for long periods of time does to your health even when you exercise regularly. The research on this is newer, and it suggests that being active for 30 minutes a day but sedentary for the remaining 14 waking hours has a different health profile than distributing movement throughout the day. That conversation, about how to move more consistently across your whole day, not just during dedicated exercise time, is coming up next. If you want to be there for it, subscribe to this channel. That's all it takes to keep getting clear, research-backed guidance on aging with strength rather than confusion. Take good care. Keep moving. All 3 kinds.